Hello, how are you? My name is Kaitlyn. I'm a student nurse. I'll be looking after you for today. The doctor's just ordered you to have a PCA to have some pain medication, so I'm going to go and get that all set up for you. Before I can do that though, I just need to check your ID, your name.
Yeah, no problem.
Okay, so what's your full name, please?
Mariam Adib,
Mariam Adib. Your date of birth, please?
the 7th of the 1st, 1996. Oh, 69, sorry.
Yeah, okay, and my number 174963, 174963. Miriam, are you allergic to anything?
No.
No? Okay, a couple of things I need to do before I go and get your medication. I just need you to tell me a little bit about your pain. So can you tell me where your pain's located?
On my ribs.
On your ribs?
Broke my ribs.
Okay, how long's that been going on for?
For a couple of days, maybe 2-3 days.
Okay, and on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever felt, what was your pain score right now?
8.
It's an 8? Okay, no problem. Alright, just need to check your cannula site. Alright, looks pretty good. No inflammation, no redness. Okay, that's all good. Alright, pop that back on for you. I just need to check your vital signs as well, just to record a baseline data before we give you the morphine medication.
No problem.
So I'll do that as well. Okay, so I'm going to be back in a little while. I'm going to go gather all the equipment and get that ready for you. If you need anything, just buzz and let me know.
No problem.
Okay. Would you mind being my second Maria? I just need to validate this order. So the patient's name is Miriam Adib, date of birth 7th of the 1st, 69, MRM 174963. Her ID has already been confirmed and she's got no known allergies. So the doctor's ordered a PCA order. The indication is for the fractured ribs of the patient. The drug to be given is morphine 50 milligrams in 50 mils. The doctor has signed, printed, dated, a left-hand number as well. So the PCA via morphine, the concentration is 1 milligram per mil. Number of syringes is 3. PCA dose is just 1. The lockout interval is at 5 minutes. There are no basal infusions. The hourly dose limit is 12 milligrams. The doctor has signed that. The doctor has also written up antiemetics for the PCA, metoclopramide. The dose and route is 10 milligrams IV. Interval is TDS. It has been signed and dated. There is also naloxone. Dose and route is 0.2 milligrams IV. Interval is 2 to 3 minutes. Signed and dated. And it has not been given yet either. So therefore, is Charlie valid? Do you agree?
Yeah.
Okay. So I'll just have a quick look about the medication that we're giving up. Okay, so we're giving morphine today. The use is an opioid analgesic. It is indicated for moderate to severe pain. The contraindicates bronchial asthma, obstructive airway disease, or respiratory depression. The precautions are in high doses, rapid administration or repeat administration. The adverse reactions are respiratory depression, apnea, circulatory depression, GI upset, dizziness, sweating. It interacts with other CNS depressants. And the dose here for PC as well is 0.5 to 1.5 milligrams with a lockout of 6 to 10. Okay, and I'm just going to do my calculations as well.
Yeah.
Okay, so we need 50 milligrams is the stock required, and the stock strength is 10 milligrams per ampule or unit. So we're going to give 5 ampules of morphine. Okay, so in each ampule there is 2 ml of, in reconstitution 2 ml. So the 2 times 5 ampules is 10 ml, and we need it constituted in 50. So we need to have 40 ml of normal saline diluted with the medication, and that is 4 ampules. Okay. So over here, okay, so I'm just going to go gather my equipment. Behind you. Okay, so I've got that. Gloves. These. Just going to go to the drugs cupboard and get our morphine out. If you want to check with me. Okay, so it's for morphine. So we've got morphines. So we've got morphine 10 milligrams. Okay, so as per my calculations, we need 5 ampules. To start with, I'll just grab my pen, fill out the details. Okay, so the amount we need is 5, but let's just count. So this is how many we've got in our drug cupboard at the moment. So there's 1, 2, 3, 4, morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate. It's 10 milligrams, 10 milligrams, 10 milligrams, 10 milligrams in 2 mils. Expiry is 10, 20, 10, 20, 10, 20, 10, 20. So that's 4. 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Morphine sulfate, 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 morphine sulfate. All in 10 milligrams 2 mils, 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 10 milligrams 2 mils. Expiry 10, 20, 10, 20, 10, 20, 10, 20, 10, 20, 10, 20, 10, 20, 10, 20, 10, 20, 10, 20. Okay, so that's 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24 of morphine sulfate, 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 and 10 milligrams 2 mils, 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 expiry 10, 20, 10, 20, 10, 20, 10, 20, 10, 20, 10, 20, 10, 20, 10, 20, 10, 10, 20. Okay, so we need 5 ampules. Okay, so 5, so there will be 19 remaining. We have 24, there will be 19. Okay, just fill out this, scrubber. Grab a dodgy pen. Okay. Okay, so we've got 2, 3, 4, 5. And I'll sign. Okay, so we'll just count the rest back in. So we've taken 1, 2, 3, 4, 5 out as per our medication chart order, which is here, 50 milligrams, so we need 5. So that means remaining, we will have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 of morphine sulfate, 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 morphine sulfate. 10 milligrams 2 mils, 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 expiry 10, 20, 10, 20, 10, 20, 10, 20, 10, 20, 10, 20, 10, 20, 10, 20, 10, 20, 10, 20. So that's 10, 11, 12, 13, 14, 15, 16, 17, 18, 19. Okay, morphine sulfate, 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 morphine sulfate. 10 milligrams 2 mils, 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 10, 20, 10, 20, 10, 20, 10, 20, 10, 20, 10, 20, 20, 10, 20, 10, 20, 10, 20, expiry. Okay, so there is 19 going back in. Okay, and lock. Okay, I just need to fill this in. 19, 0. Okay. Alright, so I'm just going to do my first drug check. first drug check, do you mind checking with me, checking this? First drug check, the patient's ID has already been confirmed, she's got no known allergies, so the drug order is for morphine 50 milligrams and 50 mils. So here we've got morphine sulfate, injection, morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate, 10 milligrams 2 mils, 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 expiry 10, 20, 10, 20, 10, 20, 10, 20, 10, 20. That's the morphine, and as per my calculations, so we've got, to make up the 50 milligrams, we need 5 ampules, and then we also need to make up the extra 40 mils diluted in normal saline to make the 50 mils. Yeah. So I've got sodium chloride here, sodium chloride, sodium chloride, sodium chloride. And it's 10 mil, 10 mil, 10 mil, 10 mil. Expiry October 17, October 17, October 17, October 17. Beautiful. Okay, and so it's for the PCA use. It has not been given, and it's due now. My first drug check. So I'll leave that there. And now I'll draw out my morphine medication. So I'll do my second drug check. I've drawn up the morphine now. The morphine is in my syringe. Okay, so second drug check, the patient's identity has been confirmed. She has no known allergies, so we're giving morphine. It's 50 milligrams and 50 mils. So I have here now drawn up, so 10 milligrams in my, 10 mils in my syringe, which is, lay them out here. Morphine sulfate, I have 5 ampules as per my calculations to get to the 50 milligrams. So I've got morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate. Is 10 milligrams in 2 mils, 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 expiry 10, 20, 10, 20, 10, 20, 10, 20, 10, 20. So I've got my 10 mils here, so that's my 50 milligrams of morphine in my syringe. We are giving it, so we've got our patient, no known allergies. It is for PCA use. It has not been given yet. Can have been signed and printed by the doctor. Okay. Yeah. Now I'm just going to add. I'll check in my normal saline as well with the drug order. So we're going to add in, to make up the 50 mils, the 40 mils remaining in normal saline. Sodium chloride, sodium chloride, sodium chloride, sodium chloride. 10 mils, 10 mils, 10 mils, 10 mils. Expiry October 17, October 17, October 17, October 17. And now this is going into my syringe. I'm going to take off my syringe now, my needle, and I'll dispose of that in the sharps bin. Tangled. Very tangled. Okay, this one. Okay. Okay, so I'm just going to attach this on, complete my label. So would you be able to check this fluid label for me? So let me just. Okay, so we've got our morphine is 50 milligrams, 50 mils. I'll do the third drug check later, just after I check that, but just want you to check the label. So we've got 50 milligrams in here. And just need you to sign. I'll push through. Okay, attach my fluid label. Thank you. Okay. So Miriam, I'm back with your medication. I've just got that all set up for you for your PCA, your pain medication. Before I can give that to you, I've just got to check your ID just one last time, if that's okay with you. If you could tell me your full name.
Mariam Adib.
Mariam Adib, your date of birth, please.
The 7th of the 1st, 1969.
7th of the 1st, 1969. Your MRN number is 174963. 174963. Do you have any allergies?
No.
No? Okay. Now I'm just going to do my third drug check. Okay, so the patient's identity has been confirmed. We've done 2 patient checks. She's got no known allergies. So the drug we're giving is morphine 50 milligrams in 50 mils. So as per my calculations, we needed 5 ampules of morphine to make the 50 milligrams. So we've got morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate. So 10 milligrams, 10 milligrams, 10 milligrams, 10 milligrams, 10 milligrams in 2 mils. The expiry is 10, 20, 10, 20, 10, 20, 10, 20, 10, 20.
Yep.
So it was already diluted in, the 50 milligrams comes in the 10 mils there, so I had to add 40 more millilitres in the normal saline.
Yep.
Okay, so I've got Sodium chloride, sodium chloride, sodium chloride, sodium chloride. It's in 10 ml, 10 ml, 10 ml, 10 ml, expiry October 17, October 17, October 17, October 17. So that's to make up my 50 ml.
Yep.
So it hasn't been given yet. It's due be now to put up. The doctor signed and printed, and everything's been checked.
Yep.
So I'm just going to go and set up the PCA now. And I'll prime my line. No bubbles in that. Okay, Mira, I'm just going to set up your medication now. Won't be too much longer. Okay, so just making sure that's alright. Just quickly put on my gloves. Okay, Miriam, nearly all ready to go. Just going to connect this up to you. Going to just quickly clean your cannula. Okay. Looks good to go. 15 seconds, just going to clean this. Okay. My clamps are open. Morphine, so it's 1 milligram per 1 ml. PCA dose, lock out of 5 minutes. Lock out of 5 minutes here. Continuous bolus, no, at 0. Okay, so I just need to modify this criteria. Alter. Should I change the hourly dose limit to 12? 12, confirm that. Okay. Alright, all my clamps and stuff are off. Okay, next protocol. Morphine. I don't know. Which one did we do? This one, that's the one. Okay, turn my key. Confirm my protocol. Confirming. Confirm syringe. Okay. And we're starting. PCA is available. Okay, Miriam, so a little bit of info about your PCA. So you have a buzzer here with a bright green button on it. That controls all of your pain medication through this PCA. It is controlled, so you can't overdose, or if you're scared about giving more medication than you should be, it is all controlled. There is a lockout. There is a lockout of 5 minutes, so you can press it once, but then you'll have to wait 5 minutes to use it again. The light green button will light when it's ready for another dose. It is completely up to you whether you use it and how often you use it, but it does have a lockout. So whenever you need your pain medication, you can just press this green buzzer, and that's all connected and all ready to go for you now. Just leave you with you've got your other buzzer here as well somewhere. I'll just quickly come have a look. I'm going to come and check back on you in 15 minutes just to make sure that everything is running okay. Oh, here it is. If you have any concerns or you feel a bit dizzy or you just don't feel right at all, just press that buzzer and I'll come back and fix things up for you. Okay, so I'll see you soon. Okay, I'm just going to finish filling out my charts. So the date up is the 7th of the 3rd, 17. This isn't writing on here anymore. It's just been written on so many times that it's now not working. Just pop it in. Nope. It's actually not working at all. Perfect, thank you. The time up is 13:48. Okay, checking nurse, would you be able to initial the other side of this? Okay. It's all gone a bit smushy. Okay, and then I'll just dispose of my equipment. And that's all.